Yes, sir, we put it in the notes. NCA right now at this time. We'll notify you as soon as the one comes available.
Tonight, new evidence raising more questions of systematic failures deep inside Denver's emergency response system. When you dial 911 in an emergency, you probably expect a rapid response to help save your life.
Well, Denver 7 Investigates has uncovered new data and information exposing extended wait times for Denver residents requesting emergency help. Once again, here's Chief Investigative Reporter Tony Kovaleski.
Checking an update for ambulance.
You are listening to radio conversations between firefighters and dispatchers.
Any chance we got an ambulance coming yet?
You're getting a rare look inside the often undisclosed dynamics of emergency calls.
Do we have a bus assigned to us yet?
Listen closely as a Denver firefighter checks to see if an ambulance, he calls it a bus, is on its way.
That is negative, sir. They have the call, no assignments yet.
The dispatcher confirming Denver Health has the call, but there are no crews available for what the firefighter has labeled a critical emergency.
And it's code 10, correct? That is affirmative.
Denver 7 Investigates has combed through several days of radio communication.
Yeah, can you timestamp ALS arrival, 25-minute response time?
Conversations that uncover frustrations from firefighters. The hidden story of waiting and waiting for Denver Health ambulances to arrive.
Copy that, sir. ALS arrival, 25-minute response time.
There's been a lack of accountability.
He's a current Denver firefighter asking us to disguise his identity so he doesn't lose his job.
How common are delayed, extremely delayed response times from Denver Health?
It feels regular. And again, the problem is I don't have the data, we don't have the information to know how often it actually happens.
If the ambulance was delayed or didn't show up for a longer period of time, there wasn't much for us to do while we were waiting.
After 3 years of service, Kevin Apperon recently left Denver Fire. He's a licensed and trained paramedic, but Denver Health's leadership did not allow him to use his paramedic training to save lives.
Do you think Denver Health wants the people of Denver to know how long firefighters are waiting?
Absolutely not.
With that in mind, realize Denver Health says the data we're about to share with you cannot be trusted and should not be used for analysis. This database, managed by the Denver Fire Department and obtained exclusively by Denver 7 Investigates, shows how long firefighters in Denver waited for ambulances last year. It's important to note, Denver's fire department has a different perspective on the data, writing in a statement, "We firmly support the accuracy and methodology of the data." Denver Fire's data shows nearly 8,000 calls last year where firefighters were on scene and waited more than 10 minutes for an ambulance to arrive. More than 1,600 calls where fire crews waited more than 20 minutes. More than 450 calls where firefighters waited at least 30 minutes. And 141 calls where Denver fire crews waited more than 40 minutes for an ambulance to arrive.
Dispatch, did we ever get an ambulance assigned? That's negative, sir.
These are radio communications from December 1st of last year.
Just see if they've assigned an ambulance to this call yet.
You're listening to calls from 3 different fire crews. It's 6:42 in the morning. Fire crews asking for updates on the availability of ambulances.
Just checking to see if we have an ambulance responding.
A 5-minute look into a system that, according to the radio communications, offered no ambulances for 3 Denver residents needing immediate emergency help.
Engine 8, same traffic. They have no buses available at this time. Stand by. Engine 1, Engine 26, and Engine 8. We'll let you know.
Again, the dispatcher referred to ambulances as buses. The 3 emergencies were all within a 4-mile radius. No ambulances available, a moment confirmed in this email sent by a Denver firefighter. It references waiting more than 30 minutes for an ambulance for a critical Code 10 emergency. The firefighter wrote, "This seems unacceptable," and added, 3 other units on calls in different parts of the city were waiting for ambulances at the same time. Our review found multiple examples, including this email from another firefighter, also in December of last year. We talked with the ambulance crew and they said there were only 4 ambulances on the street for the entire city.
Help me understand how that's acceptable in a city like Denver.
I'm sorry, I can't help you understand that.
We shared the data and the findings of our investigation with Denver City Council member Kevin Flynn.
What did that data say to you?
30 plus, 459 times last year, and that's a problem. Where are our units deployed? Why can't we get there sooner?
And that's the question we wanted to ask Denver Health's medical director. How can he explain what we heard in the radio calls, what we read in the emails, and what was said by veteran Denver firefighters?
We've reported some critical things. Why are you walking away from our questions? We just want to hear your perspective. Are you going to change anything? Sounds like the answer is no.
That was after a city council meeting in March. Dr. McVaney and Denver Health have again declined to answer questions about what our investigation has uncovered.
Based on what we have in this data, should Dr. McVaney explain to the people of Denver why?
Certainly, I think Denver Health should tell the people of Denver what's the problem here and how do we solve it, more importantly.
Any chance we got an ambulance coming yet?
So here's the key issue. Denver Health says the wait time database compiled by the Denver Fire Department is misleading. But Denver Health refuses to let us and let you see the hospital's response time database. In the end, Denver Fire says its database accurately portrays how long firefighters wait for ambulances. It shows that 16% of the time last year, firefighters waited at least 5 minutes, and nearly 150 times fire crews waited more than 40 minutes. That's the heart of the issue and the heart of the problem. I'm Chief Investigative Reporter Tony Kovaleski.